All right, so I guess I left you guys hanging a little bit from last time. Sorry. I went in for on Monday for fluids, and they had said that results, at first they said the results for the BRaf marker had not come back. So from my understanding, each tumor has been tested, and they've found different, breast cancer has a lot of different markers on it. And then they create a drug that will attack that marker. And so it will identify cancer due to the marker that is on that specific cancer. So the BRaf could have potentially been in the kind of the form of cancer I have. However, it was very minimal chance that there would be a BRaf marker. So they said the results had not come back yet. But in the meantime, for the last few days, my raspy throat has turned a little bit into a dry, hacky cough, and it kept me up most of the night. And then my continued side effect from before, with a little less of an appetite or getting in the fluids I needed, has been a continued problem. So based on the assumption from last time that Dr. Chawla thought I had some probably abdominal infection going on, now they think I potentially have some inflammation in my lungs, which is also was predictable in a sense that, like, when the immune system, if you remember from the beginning, gets all revved up, like, some areas in your body are going to be like, wait a minute, what is going on? So that's kind of where I'm at. My body's at. So apparently I'm having some revolts, some revolutionary inside of me that aren't so happy about this revving up immune system. So due to that fact, those who know me know that I hate steroids. I hate them. They're not my friends. And I'm going to look like this. And I am going to feel terrible. Or maybe I'm not. Maybe it will be just fine and it won't happen. But so today, it's Wednesday, so it's been 3 days since I got a call from Misty, and she called about the BRaf. So drum roll. What do you think? No BRaf. I don't have a BRaf marker on my tumors. So no slam dunk there, unfortunately. We've been waiting for it, much anticipated, but just so minimal chances that sure enough I don't have it on my tumors. So that was not good news. And then when she heard my cough and I told her some of my symptoms, she said, well, let me talk to the doctor. And then she just gave me a call back and she said, prednisone it is. So starting today, I get to start steroids. Just kidding. It's fine. It is whatever. So just pretend like you remember me, not like a steroid face. I don't know what one's better. I don't know. Anyway, so we have family pictures today. So good thing I got that scheduled before this whole steroid bout. And then I'll find out Friday what that means for my treatment. The nurse didn't seem to know whether or not that means from my understanding, it was like a 30-day taper, but she said you just take it for the 2 days and then you talk to Dr. Chawla. So from there, I don't know. So my first understanding is that prolongs, it would push out my next immunotherapy. So I don't know what that means for my cancer, and I guess it depends on how those 2 treatments have already worked or not. So that's the news I have.